I'm Aubrey, your nursing tutor. Today we're breaking down shock, a critical condition where your tissues aren't getting the oxygen they need. Let's start with hypovolemic shock. Cold, clammy hands and a weak pulse are our body trying to preserve vital organ function. By constricting peripheral vessels and increasing heart rate, the body is desperately trying to maintain blood flow to the brain and heart. What's fascinating is this happens whether you're actually losing fluid, like with hemorrhage or burns, or when fluid shifts into the third space with conditions like pancreatitis or liver disease. Your vessels don't care where the fluid went, they just care that they don't have enough. Cardiogenic shock shows us what happens when the pump fails. Crackles in the lungs and JVD are caused by blood backing up because the heart can't push it forward effectively. In septic shock, inflammatory mediators cause your vessels to become leaky and dilate. That's why patients start warm, because the vessels are wide open, but can progress to cold shock as compensation fails. Neurogenic shock is unique. The spinal cord injury interrupts the sympathetic nervous system response, so vessels lose their tone and inappropriately dilate. Without that sympathetic drive, you also get bradycardia instead of the tachycardia you'd expect in shock. With anaphylactic shock, massive inflammatory mediator release causes both vasodilation and increased vessel permeability. Plus, respiratory issues are caused by bronchoconstriction, making it an airway risk. Obstructive shock demonstrates what happens when blood can't flow freely. The body is unable to circulate blood effectively around the obstruction. Understanding these mechanisms helps you anticipate what your patient needs and why your interventions work. Follow for more.